I haven't polled any members of the House to know what their feeling is on the Medicaid expansion. I know the governor is still looking at various options and still has a lot of questions, and I'm waiting on him to look and see what the answers are to his questions.
All right.
Yeah, nobody likes the idea of just this sort of blanket, Obamacare expansion, but that's not what the governor's looking at. I know he's real curious about what's happening in Arkansas with their initiative to use Medicaid dollars for private insurance, and he's really trying to understand. I talked with him about it today. Show me in black and white what the impact is, positive and negative, if you're a hospital, if you're a physician's practice group. What does this really mean? And I'd suggest, unless people can really give him those facts and figures, I don't think he's any more interested in it than we are. But he's doing his due diligence. He's doing what a good governor ought to do.
Well, Leader Norris, you're never one to shy away from criticizing the federal government and their budgeting practices. How do they even have the money to be making the progress, making the promises that they're making, that they're going to pay for this going forward?
Yeah, we've been there, done that with TennCare. I was here, and so was my friend, when we had to cut people off of TennCare.
Yes.
And we don't want to have to do that sort of thing again.
We don't want to put them on and have to take them back off.
We had folks when Bredesen was kicking them off TennCare on dialysis, folks with brain cancer, folks on oxygen treatments, and of course you guys didn't pay much attention to Governor Bredesen when he took those draconian measures, but
I don't know, the team report was around at the time. Well, the response, and some people say, well, it's better at least to have them get insurance for the time that they can get it, and then, deal with the not being able to pay for it later when it becomes necessary. What's the response to that?
Doesn't impress me. I think it's more about really what's in the best interest of the people who need the health care, and what level of care they can get. Expanding Medicaid, per se, doesn't necessarily improve their conditions. Perhaps using dollars to buy private insurance to get them access to quality health care is something that ought to be considered. But quality health care and Medicaid are not synonymous.
I've been on record as saying I'm open to listen to questions that are asked and the answers are received, and then we'll have to make that decision after we have more information.
Is it something you want to see the governor come up with a proposal this session or this year, or would you rather see him wait for a while?
There's no deadline. You don't have to do it this year or next year or the year after that. I confirmed that again today. But I do think...
And I heard you ask that question.
Yeah, in the first instance, I think it's a good thing for the executive branch. It's an executive level decision in the first instance. And I have enough respect for the separation of powers and the three branches of government and this particular governor to wait and let him reach his own decision before we jump in and try to preempt something that he may never do anyway.